Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Your child is 6 months old, but has limited or no eye contact and doesn't really smile. By 12 months, they still don't respond when you say their name. By 16 months, they're having a hard time forming words. Your child might have autism or ASD, autism spectrum disorder. According to the Centers for Disease Control and Prevention, autism affects 1 in 59 children in the US. Joining us to talk about this, how to diagnose and treat it, is Dr. Megan Craig. She's a pediatrician with the Scripps Clinic Medical Group in Santee, California. Dr. Craig, thanks so much for being with us.
Thanks very much for having me.
So talk a little bit more about the symptoms of this and when is the onset?
So there are two domains of symptoms that we think about for autism spectrum disorders. The first is in the social domain, so kids having some difficulty with socializing with others, with communicating with others, and understanding how other kids feel. And the other domain is in repetitive or stereotyped behaviors. So, for example, having trouble with a change in a routine they're very accustomed to. The typical age of onset would be before age 3, but you can start seeing symptoms at times as early as before age 1.
And do these symptoms change over time?
They can change somewhat as the child gets older, gets a little more understanding of how to socialize from outside sources, but it is a lifelong condition. So kids who have autism will continue with it throughout their lives.
So you don't outgrow this?
No, you don't outgrow autism, but over time, especially with the therapies we have, there are many different ways to treat the symptoms of autism and to help kids function really well.
And what are the potential causes?
So there are many different things that are under investigation as a potential cause of autism. We do know that genetics plays some role. If there is one child in a family who's affected by autism, there's more likely to be another sibling in the family affected by autism. And there are other things such as prematurity or lower birth weight that seem to be risk factors, but we don't fully understand how autism is caused.
And is there a difference between autism and autism spectrum disorder?
No, autism spectrum disorder and autism are the same. Autism spectrum is just more of an umbrella term that's more commonly used now.
And what are the treatment options?
Well, there are a couple of different treatment options. One of the more common is applied behavioral analysis therapy, where a therapist works with your child to modify their behaviors. Some kids also benefit from speech therapy to learn either verbal communication skills or nonverbal, such as through using sign language or a communication device. Rarely, some kids with autism do need some medication. Not all kids do, but it can help manage certain symptoms that may cause problems for kids with autism, such as being impulsive.
And so what happens if autism is left untreated?
Well, autism, if left untreated, and you would see a lot of the same symptoms of difficulty engaging in social interactions. And I think it is really important to intervene and try to help kids who have autism with treatment, because they can really have a lot better outcomes. The earlier you intervene, the easier it is for kids to learn certain social skills and help them get through preschool, early elementary school years.
So what are some of the common misconceptions about autism?
One of the common misconceptions is that there is a link between vaccination, particularly with the measles vaccine, and the development of autism. However, that's been really thoroughly disproved. There is no link between vaccination with the measles vaccine or any other vaccine and the development of autism. So kids with autism should have vaccines the same as everybody else should.
Can a change in diet help the symptoms of autism?
There's no proven diet or evidence to say that there is a certain thing you should eat or avoid that would help with symptoms of autism. But like all kids, kids with autism should have a varied diet, eat fruits and vegetables, and try to minimize soda and juice.
So what do you do if you suspect that your child has autism?
Well, the first thing you should do is talk with your primary care pediatrician. It's our job to check at well checks and at other visits to make sure that kids are developing in the way we expect. And if there's something that you're worried about, that's a great place to start. If the symptoms do sound worrisome to your primary care pediatrician, you would be referred for further evaluation by a pediatrician who specializes in behavior and development, or by a psychologist, psychiatrist, or child neurologist who would do a more thorough evaluation.
So talk about the emotional stigma of this condition.
Yeah, I think it can be very difficult either at school with kids being teased or bullied, or in the workplace when people don't understand autism or its symptoms. There can be shunning as well, which is really unfortunate. Something that is becoming less common now, that autism is more common, people are more aware of it. So I think that's been helpful as well in raising awareness. I think it's important, especially for young people, to have some kids who are in the same situation, whether that's through support groups for autism, social skills groups for autism. A lot of families turn to social media to find other people who are going through the same kinds of things.
And what about the emotional stigma of people thinking you have a mental illness?
I think it's important, instead of focusing on there's a mental illness component of it, to try to think about how we can help somebody with autism and how we can help them interact or get through some of the symptoms they're having. For example, kids with autism might be very sensitive to noise. So you might even see them on the playground covering their ears or trying to avoid noisy situations. And in that case, instead of pointing out to other kids, like, oh, that's very odd, I wonder why they're doing that, you can know that maybe there's something behind that behavior and move them to a more quiet environment, and bring to a place of understanding that that child can't really communicate that they need some help, but that there is something you can do to help them.
So if you have autism, how can you be your own advocate? Or if you have a child with autism, how can you be their advocate?
I think as a kid with autism, if you're in school or people are bullying you or not understanding of what's going on, I think one of the most effective ways to help with bullying is to kind of turn it around, show the bully that what they're saying isn't bothering you. For example, if someone's getting teased about hand flapping, which is a common behavior in autism, and someone says, that's so odd that you're flapping your hands like that, you say, oh, thank you, I noticed that too. Just something that they don't expect to hear, that shows that their comment didn't bother you.
And if you have a child with autism, how can you be their advocate?
Think, apart from instilling confidence in them and teaching them to advocate for themselves as well, educating people and being involved with either the school or telling family and friends what the diagnosis is, how it affects them, and just being upfront and direct about how they can support your child can be very helpful.
To provide that kind of loving and supportive environment.
Yeah, absolutely. And to tell other people what's going to be most helpful for your kid in dealing with certain situations. It might be a little bit different than what would be helpful for a kid who does not have autism.
Any final thoughts, doctor?
I think autism is a very common diagnosis that is very treatable, especially if caught early on. If you are suspicious that your child is not developing normally or suspicious that they have signs of autism, don't wait at home. Come to see the doctor, even outside of your regular well checks, so that we can get started in further evaluation and signing them up for any therapies that may be helpful.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Of course. Thank you so much for having me.
So if you want more information on autism, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.